Hi everyone, and welcome back to my channel. For those of you who don't know me, my name is Ashley and I just completed my internal rotations at the Virginia Tech campus for my veterinary clinical year. In today's video, I'm going to be going through all of the internal rotations that I went through and kind of what my experience was with each one, discussing kind of the on-call shifts and also dress code and other supplies that you're going to need during these rotations. I did my first 3 years of vet school at St. George's University, and then I went to Virginia Tech, which is Virginia, Maryland, for my clinical year. I did kind of explain all of the different requirements for placing into your clinical year school, so I will link that video down below. First off, I just wanted to go over some general things with the Virginia Tech clinical year schedule. The on-call shifts for weekdays are typically 5 p.m. to 8 a.m. the next day. And then for the weekends, it is from 8 a.m. to 8 a.m. the next day. For your days off during your clinical year, at Virginia Tech, it is pretty strict, but I feel like they follow pretty closely to other vet schools. You get 5 personal days off the entire year. That does not include interview dates or sick days. Those are separate, and travel days are also separate too. For the interview days, I believe you get a total of 5 days. For sick days, you can have 3 days. With all of that being said though, you cannot miss more than 3 days per clinical rotation. For all of your externships and external clerkships, which is what they call it, you do have to get it pre-approved through a portal system. If you are a public corporate tracker like I was, you will have to do this twice for any public corporate track elective. You do have to have one externship that is a state or federal position that lasts for a total of 3 weeks. So keep that in mind if you are considering that track. I would absolutely highly recommend that you try your best not to schedule your hardest rotations during the times where internship and residency interviews are happening, because it is very difficult to get time off during those rotations, and also try to avoid these tougher rotations during the NAVLE. For vacation purposes, that is actually separate from the travel day, the personal days, the interview days, and sick days. You do get 1 week off during the winter break, so either Christmas you are off or New Year's you are off. You kind of split that up between your rotation mates. You also do get 1 week off during the fall break as well, and then you do get a whole separate vacation block that is 3 weeks long. You do have to take that all at one time though, so just make sure that you know that ahead of time. So the nice thing is with Virginia Tech, like you don't see at most vet schools, they have 5 weeks off for the student already built into the schedule, so I think that's very generous, and definitely make use out of that when you can. For travel days, this technically means if you have an external clerkship starting after a primary care rotation, you can take a travel day on that Monday and start your externship on that Tuesday. So you have a travel day set aside. You do have to get this pre-approved ahead of time, just like with everything else. The nice thing is with the St. George's University students, they do allow us to track at our clinical year schools if they allow it. However, with Ross University students, I don't know if this has been implemented yet, whether or not they can track, but I believe that they're usually put into the mixed animal track at Virginia, Maryland, just based off of the agreements that they have. I did my anesthesia rotation first at Virginia, Maryland when I first started, And I absolutely loved this rotation. I learned so much throughout this 3 weeks. For the anesthesia rotation, you are doing anesthesia for any animal that has a surgical procedure going on at the hospital. So it could be small animal, it could be large, or it could be even an exotic animal if they do have a surgical procedure happening during that 3-week block. It is up to the students to decide which cases they take, but usually you rotate around so everyone gets a chance to do an anesthesia case. I typically had at least 1 case per day. It could be 2 or it could be 3 cases per day, depending on how busy the schedule was looking. They do have several surgery suites for the large animal side and the small animal side. So usually there's multiple procedures happening at one time. The staff was really incredible to work with. You are actually in charge of the case yourself, but you do get it pre-approved with your clinician before anything happens with the patient. During the mornings, if it's slower, they will do topic rounds on different drug classes, which I thought was a very nice review for the NAVLE especially. For the dress code, you do have to wear a white coat, clean surgical scrubs, meaning you cannot walk into the hospital wearing scrubs. You have to change into scrubs at the hospital because they do not want you tracking anything inside the surgery suites. You do need a stethoscope, a thermometer, closed-toed shoes, bandage scissors, suture removal scissors, pens, Sharpies, a watch, and your radiology badge as well, which they do supply at the Virginia, Maryland campus. It's on the radiology student wall. They do provide it for all of the interns, residents that are there, including the visiting students from the island schools. You have a total of 4 on-call shifts during your anesthesia rotation. You have primary and secondary on-call shifts. So there are always 2 people every single day on call, just in case there's multiple surgeries going on. I would definitely recommend bring plenty of drinks and food with you because you do not have a scheduled lunch hour. So definitely be sure to eat or drink anything before your procedure actually happens because you could be in there for a while, especially with any back surgeries or horse surgeries. Those can take a long time to do, and you do have to stay in the room for the entirety of the procedure. I would also recommend bringing another pair of scrubs with you, just in case you have 2 surgeries in one day. The normal shift for this rotation is weekdays only, so I believe it is from 7:30 in the morning until 3 p.m. But if you do have a procedure going on that ends up being later, you do have to stay for that. So you don't always get out at 3 p.m., but you're only scheduled during the weekdays unless you're on call on the weekends. For the community practice and theriogenology rotation, I honestly was not a huge fan of this rotation in particular, just because I'm not a big fan of general practice, which is basically what this rotation was. It's just not for me, but I know for a lot of people, they do actually really enjoy it. During this rotation, you will see sickness cases, wellness appointments, and reproduction appointments. If you are lucky enough during this rotation, you could be doing a surgery as well. So if that is something that interests you, definitely be sure to sign up for those cases. The student does get to pick what cases they take that day. I typically saw from 1 patient to 5 patients in one day. So it really just depends on how busy you want to be. You do have to do a lot of callbacks with this rotation because every patient that you do see, you do have to call them the next day to check in on them. The dress code for this rotation is a white coat, scrubs, stethoscope, thermometer, watch, pens, and Sharpies. The normal shift for this rotation is just weekday shifts. If there is a patient over the weekend, the on-call people will take it. Every student has to pick up one of the weekends. However, if there's no patients that are hospitalized that weekend, you also get that weekend off. So it's actually a nice trade-off. So you may not be working at all on the weekends during this rotation if you get lucky. During this rotation, you are responsible for the medical records and, like I said, following up with the patients. There are technically no on-call shifts with this rotation. However, you do have to sign up for one of the weekends, and if there is a hospitalized patient, you will be taking care of that patient. They also do have something called Student of the Day with this rotation, and basically that means for any patient that is staying in the hospital for the day for like a surgical procedure or needing treatment, you cannot leave until those patients leave the hospital. Because usually it is a same day pickup, but you do have to stay and make sure and clean up after everybody has left. For the emergency and critical care rotation, I surprisingly really enjoyed this one because you got to do so much with the patients and with the clients. You were the one in the room doing the physical examinations, you were the ones in the room talking with the clients and hospitalizing the patients, and you also had shifts in the ICU as well, so you were taking care of the more critical patients too. The nice thing about this rotation was that there was no on-call shifts, and your shifts were for approximately 8 hours. The worst part about this rotation, I felt like, was the fact that you may be the only student working during that time, which makes it really challenging if you have 6 or 7 patients that walk in at the same time. The dress code for this rotation is scrubs, bandage scissors, thermometer, stethoscope, a watch, pens, Sharpies, and a notebook is really important for this rotation. Unfortunately, your schedule is never going to be the same, and you can have weekend shifts with this one. So you could be working anywhere from 6 a.m. to 3 p.m. or the next day you could be working 3 p.m. to midnight, or you could really be in trouble and do a day doing 11 p.m. to 6 a.m. in the ICU. That's never fun. If you are in the ICU as well, you could be called into the ER if they start getting really backed up with patients, depending on how everything works out. Bring plenty of snacks and drinks with you because you will need to eat when you can, because it can get really busy or it can be really slow. It just really depends. You are responsible for the medical records for this rotation, and you are responsible for triaging your patients who are out in the lobby. So, meaning you take a lot more responsibility in determining who is the most critical patient to see first. The scheduler for this rotation does do their absolute best to make sure you do have 2 days off during each week. However, it's not guaranteed that it's going to be consecutive 2 days off, so you may have to switch from day shift to night shift really fast. For the large animal medicine and surgery rotation, I will 100% admit this was my least favorite rotation at Virginia Tech. It was really, really stressful all the time. We only had 5 students on the rotation, and it was very, very hectic. You will be mentally and physically exhausted with this rotation because you are pulling 12 plus hour shifts every day, including the weekends. So since this rotation is split up into medicine and surgery, you will do a week and a half of medicine and a week and a half of surgery. So you will switch during the middle of the rotation, which can be a little bit challenging because you're used to your own patients, and then you have to switch to someone else's patients. You do get to choose what cases you take, including the surgery cases. The dress code for this rotation is boots that are not steel-toed, khaki pants, can be any color, and collared shirts, a stethoscope, thermometer, pens, and Sharpies. With this rotation, you do quite a lot of hands-on. You're the one doing the physical examinations. You are the one doing the husbandry for the animals first thing in the morning, so it is not uncommon to be there at 5 o'clock in the morning, taking care of your patients before you start at 8 o'clock to round on your patients. The clinicians try their best to limit these students to 3 patients to handle on their own. However, this typically does not happen, as was the case for me. I had 11 patients one weekend that I was handling on my own. Bring plenty of drinks and snacks with you, bring blankets, anything that you want, because you will be at the hospital for a long time every single day. If you are on call and get called in, you do have to report in the next day and also take care of that hospitalized patient now, if they do spend time in the hospital. You will have 4 on-call shifts typically. You do get 1 weekend off during this rotation, and you do have to coordinate it with your colleagues because you cannot have more than a few students off per weekend, so definitely keep that in mind. You are responsible for making sure that each patient has enough medication to last them throughout the weekend. For the pathology and laboratory diagnostics rotation, this one was super fun, but super smelly as well. So definitely be prepared for that. If you are sensitive to smells, this is probably going to be a hard rotation for you. You will be doing necropsies every afternoon during the weekdays. You do not have any weekend shifts unless you are on call. For this rotation in particular, the only thing that you really need to bring with you is rubber boots. Coveralls are provided, and they do have multiple different sizes, so you don't need to worry about any of that. During the mornings, because necropsy is typically in the afternoon around 1 p.m., you review necropsy reports that you did the day before. You do clinical pathology rounds, parasitology rounds, cytology rounds, and histopathology as well. You do have 6 on-call shifts for this rotation, and there is a primary and secondary person on call. The nice thing with these on-call shifts is that you are not going to be responsible for doing the necropsy itself. You are just responsible for putting the animal in the cooler. If there is a large animal coming in for necropsy, they will call in both students to put the animal in the cooler. You do have to use a special system to hoist the animal up, and they call in both students in for safety reasons for any large animal. You are also responsible for ensuring that the paperwork is complete and ready for the necropsy tomorrow. Next up is the radiology rotation. So this rotation was probably the least effective rotation. I feel like I didn't learn much at all during this time. So I actually did do a 1-week externship to improve my imaging skills away from the university because I knew I wasn't going to learn much during these 3 weeks. The dress code for this rotation is scrubs and closed-toed shoes, and your radiology badge as well. During this rotation, you will have at least 3 ultrasound days where you will help prepare the patient for the ultrasound. You won't actually be doing the ultrasound yourself. You are just there to help position the patient and keep them calm if they're not sedated. For the rest of the rotation, you are just helping position patients for radiographs. You aren't necessarily interpreting the radiographs themselves. If it is a surgery case, though, for a TPLO or any other orthopedic surgery, they typically will not allow students to help position the animals just because the surgeons want it done a certain way. You will also be helping out with the CT scans and MRIs and the C-arm if there's any cases that require that. There are morning rounds, so typically you don't even go into the hospital until like 9 or 10 a.m. every day. So it's quite nice. This is only a weekday shift unless you're on call on the weekends. Then you don't need to come in on the weekends. There are 2 examinations that you have to pass for this rotation, but both of them are open note, open book. There are 6 on-call shifts, primary and secondary. This was probably my hardest on-call shifts because I was called in like 5 or 6 times in one night during like Christmas Eve, and it was rough trying to come in the next day to work. But thankfully they let us out sooner that time, so it wasn't too bad. But sometimes your on-call shifts can be pretty brutal. It just really depends on how busy it gets and what service you're on. For the shelter medicine surgery rotation, I feel like this rotation was pretty good. There were some things that I would love to see change, but for the most part, I feel like this rotation was okay. You do go to 3 different facilities, which could be a humane society or a low-cost spay and neuter clinic. The dress code for this rotation is clean surgical scrubs, meaning you do have to change at the facility. You cannot wear the scrubs in, and you can bring in your own surgical cap if you want to. They do provide everything else so that you will need, like the surgical gloves. There are no on-call shifts or weekend duty for this rotation, which I thought was wonderful. And this was the only rotation that had scheduled lunches. So they made sure every student would get to eat, which I greatly appreciated considering we were the ones doing the surgeries. You will be doing spays and neuters only on cats and dogs. You will also help run anesthesia, help with vaccinations, do medicine cases, and bathing dogs at one of the facilities. The days can be pretty long, but it just depends on how many surgeries are actually happening during that day. We had as little as like 4 surgeries one of the days, but then another day we had like 30 something surgeries happening. So it just really depends on how busy the time is. The thing about this rotation is that it was pretty chaotic all the time because you were moving to different facilities, so you didn't know where things were. The caseload can sometimes be very complicated. You could be working with feral animals as well. And I feel like the rotation itself was a little disorganized as well sometimes because sometimes the buildings weren't even open when the students got there. So we were outside in the cold waiting for several minutes, which wasn't ideal. But some of the cases that you get to see and be a part of are pretty interesting. I did a total of 14 surgeries, I believe. Some people have done even more surgeries, but I didn't do surgeries every single day like some people did, because our surgery rotation just wasn't as busy as some of the other rotation schedules. For small animal internal medicine, this was definitely a very hard rotation. The good thing about this rotation is that there are no on-call shifts. However, if you do have a hospitalized patient that you are in charge of, you do have to come in and do the treatments over the weekend. You can be scheduled for actual appointments or transfers during the day, so transfers from the emergency room in particular. You have to keep up to date on EasyVet for the transfers. If you are not there taking care of your hospitalized patient, you can get in a lot of trouble. I would recommend getting up at like 5 a.m. to check the schedule if you're on transfers that day, just to make sure you don't have a hospitalized patient, because you do have to round on your patients around like 7:30, 8 a.m. If you do have a hospitalized patient, plan to be there for 12 plus hour days, because typically there's a lot of things that need to be done with your patient. You are responsible for rounding your clinician in the morning on any patients that you have in the hospital and come up with additional diagnostics, interpreting results, planning on treatment options, and writing the medical record as well. These are extremely heavy cases, so being mentally prepared for not the best outcome is probably going to be in your best interest. I would recommend that you bring a surgical pair of scrubs with you, meaning you can change into them at the hospital if you do have a surgery happening. Typically you'll know ahead of time, but sometimes things are an emergency, so definitely be prepared for that in case it happens. The dress code for this rotation is scrubs. Definitely bring your stethoscope, thermometer, pens, Sharpies, highlighters, and a notepad for this rotation. For production management medicine, I absolutely loved this rotation. It was very exhausting, but I loved being outside during this time, because I was outside during the beginning of spring and it was baby season. So it was definitely really busy with all the dystocias, but I got to see so much, I got to do so much, and it just felt really good to be exploring the Virginia area. The dress code for this rotation is the rubber boots and coveralls. You do not have to bring your own coveralls because they have plenty for you to pick from. A watch, stethoscope, a fanny pack or a hip bag to carry all of your supplies in that you don't mind getting dirty, bandage scissors, pens, Sharpies, a notepad as well. During the road trips, bring 2 extra pairs of coveralls with you just in case you have to go to another farm. They do require that you change your coveralls for each farm just to make sure that we're keeping with the biosecurity measures and not introducing things into the other farms. You will have 1 week of ambulatory calls and 2 weeks of just regular health herd check or minor things like lameness cases. Definitely prepare for the weather. You can be out there in anything, so definitely bring a raincoat with you. Waterproof anything is ideal, especially during the springtime. You are responsible for recording anything that you do at these facilities besides the prisons. Usually the clinicians will be in charge of what happens at the prisons. Bring plenty of non-perishable foods and drinks with you because you can be out on the road all day long. Prepare for early mornings. I was not quite prepared for that when I did this rotation, but one of the days I went out at like 4 o'clock in the morning because the farm was 3+ hours away. Definitely prepare for that. If you need to bring a pillow with you, bring a pillow with you. If you need a blanket, bring that with you too. The really nice thing about this rotation is that you are not the one driving. The clinicians are the ones who are driving typically. You will have 4 on-call shifts and be prepared to go into the hospital because typically you will be called in for this rotation. The nice thing with the on-call shifts is that the individual has to bring in the animal to the hospital, so you will not be going out to somebody's farm late at night. This is a very physically demanding rotation, and please be absolutely aware of your surroundings. We had this one case where a bull jumped a fence, and thankfully it was not coming towards us, it was going back out to pasture, but this bull cleared at least a 6-foot fence. So just be aware of your surroundings. These are very large animals that you're working with. During this rotation, you are also responsible for doing laundry, for the coveralls, and there are 2 quizzes for this rotation, a parasitology quiz and a bovine quality assurance quiz. That is all of the internal rotations that I had at Virginia Tech / Virginia, Maryland. I hope that you found this video helpful. If you do have any questions about anything that I discussed in this video, definitely please let me know down below. I will have as much of the items that I purchased for the rotations down in the description box so you can find it easily too and see what actually is needed for your clinical year at Virginia Tech. Thank you so much for watching, and I will see you guys next time.